Hi, everybody. For those of you who haven't met me yet, I'm Dalibor. I'm the CEO of SORSIX. We are a private company. We have a product that does many things in healthcare. I call it a health operating system. I've seen that used a few times, but it's still a relatively new buzzword. And I'm going to try and give you a bit of a view across the markets we look at globally. A lot of our work is in Australia, New Zealand, and Canada, which are not European, except for when Horizon money is involved, in which case Canada and New Zealand are signatories and somehow in Europe and definitely want that Horizon money. Something that continues to amuse me greatly. There we go. So here are things that we are seeing. And I want to preface this by telling you, this is our experience. We work with probably close to 100 customers in terms of organizations, hundreds of people, but this, healthcare is millions of people. So this is by no means a, detailed analysis. It is what we have felt working in the market and where we see things going. So the first one is, and this was a great word from Madalena before, anti-obsolescence. This is still the case a lot, especially in developed countries, especially countries that took up technology too early. So Ontario is a bit like this right now. I'll give an anecdote. I was at a conference around this time last year, and my team was there this year. Everybody is stuck with solutions they grew in-house when software development was so cheap. You would just hire some kids from uni, basically, to build apps in a hospital, in a clinic, in a radiology practice. So this is the worst kind of anti-obsolescence. They built the practice around it. The whole world has moved on. They don't want to buy anything new because they have not been paying for this for 20 years. So commercially, even in a public setting, the budget is based on something that was an investment from 30 years ago and has not moved. People are not ready for modern technology, for licensing models. Licensing with continuous development is vital, if for no other reason, security. And healthcare data is subject to extreme security. You have to have continuous maintenance, but no one's ready for this. It always used to be buy a box. Or my favorite is, we're building a building and we're putting things in that building, and there's a 20-year plan for the building. Your plan isn't perpetual in healthcare. It is doomed to fail, especially with the way the world works now. I'll talk a bit more about that later as well. But I just want to talk about these things here. We are seeing finally focus on interoperability. I find it very amusing, the difference between sometimes the global private sector, where if the EHR isn't revitalized in 3 months, it's a crisis. And then the EHDS sensibly realizes that actually moving the world is going to take 10 years. That's a more realistic time frame. But, people do want things quickly sometimes. And very frequently, we're seeing this interesting thing, and I'll talk about it in another slide as well. A lot of procurements we've been involved with, sometimes tenders we've been ready to submit, have been just torn up. They've said, we based this tender on the wrong assumption. It's a point solution. It's got to be bigger. We didn't put enough in about integration and so on and so on. And that's what I'm mentioning around here, continuous cancellation of tenders in ANZ. And like the New Zealand government has not had a public procurement in digital health now for 2 years. In 2022, they had 5 tenders. We won all of them. And there's been nothing since. They've basically said, we need to reassess. It's an 8-year strategy now. So finally, they're sensibly realizing, like the HDS, things take time. But the main thing is, the cloud, and Anthony was talking about this before, people are starting to realize that the cloud is not a problem. Working in a browser is okay. The workflow and the functionality is more important than it being a specific tool or application. Another thing we're seeing a lot, so we work a lot with patient-facing solutions. And consumers for a long time in healthcare have too much of an impression of fungibility, contrasted with usually wanting a specific doctor that they might know. But especially this impression of fungibility in digital tools has been a problem. Not all apps are created equal. The world is littered with terrible apps that have achieved nothing, sometimes pet projects, and really great solutions like Underman 7, sometimes have trouble getting traction because there's no model for them. So, there is also this idea, and I think I mentioned it in here somewhere, maybe on another slide, this idea of what is portability of medical information and how medical information should be transmitted is also shifting. And, sometimes this always surprises me when someone comes in with a very strong view, like it has to live on a device or in a card or in the cloud, and they're often contradictory. Sometimes you even have a program that is run by contradictory leaders who have come from a view. For me, I'll tell you what I see as the inevitable future is for everything to be managed in the cloud, but in a good way and with the right kind of security protocols. It is impossible to coordinate things in healthcare if you have to carry information around. That's, that just goes back to the old way, up very quick. So to quickly sum that one up, consumers still do not appreciate quality enough when it comes to patient-facing apps. They either expect something to work immediately and flawlessly, and if it doesn't, they give up immediately, or they think everything is the same and they'll actually try and engage, but sometimes dig themselves into a hole where the health record is isolated. Last but not least, digital literacy is not a problem anymore. I think a significant obstacle to adoption. You get folks, particularly older clinicians, who might say, I'm not changing the way I work, but the market is now dragging them. And doctors' associations increasingly have in them enough of a young workforce that wants things to move. The problem with digital literacy in healthcare wasn't even just working with digital tools. It was the change management and the resistance to change because of the way of working. And Madeline, you made a great point about process driven. That will enable this, to be broken. So, sorry, I know I've talked a little too long. I'll be very quick. Basically, what we are monitoring, everybody's now digital first, which is good. Even physical devices are increasingly incorporating telemetry. There's still not enough tooling to use that, but we think there's a lot of that is going to come. And standards are still much more proficient in the conversation and the documentation than in the delivery. And I think that's going to be a big push going forward. I really hope the HDS mandates standards as well as just, being a thing. And last but not least, again, just kind of to echo that previous point, procurement is in transition. No one knows what to buy anymore. They've started to know, but there's clearly a need for more leadership in the right way to procure digital health.